Hi everybody, Simon with the Milford Regional Chamber of Commerce, and today I am at Northshore DPC with Dr. Afolalu. Did I get that right?
Afolalu, yes,
Afolalu,
yes.
who is going to be telling us a little about her practice, why she got started, and ways that it will benefit your life in general. So, Dr. Afolalu, thank you for having us here. We appreciate you being here.
Thank you, Simon.
No
Happy
problem.
to have you.
Yeah. So why did you start North Shore DPC?
So I started Northshore Direct Primary Care. It is different. It is a form of health care or primary care that is outside of insurance. So it is membership based and it affords individuals to have access to their primary care doctor and have access to care and services that they ordinarily would not be able to get easily in a traditional setting. So that really, having been in the traditional practice for over 20 years, I have seen how the patient doctor relationship was very strained by time.
Mm-hmm.
And that just led me to building something different that was able to cater to that particular need that, most individuals really crave, having that patient doctor relationship, having time, more than 10 minutes with their doctor during their visits.
That is one of the complaints I hear a lot from
Yeah.
people when they're talking about going to see their primary care. It's a wait 20 minutes after your appointment to get
Yes.
started, then go in, you get 8 minutes, 12 minutes,
Yes.
and then you're done. And
Yes.
if you have further follow-on questions, you have to set up another appointment.
Correct.
Whereas with the model you're working with,
Yes.
people can come in and have a little bit of time, and if it goes a little extra, it's okay.
Yes. So it's different because it also not only do you have access because the panel sizes are smaller compared to the traditional practice where you have many more patients to care for within a shorter time frame. Here you have smaller panel sizes and you schedule longer appointments. So patients can come in, individuals can come in and spend as much time as they need. So it's really tailored to you. Not every visit has to be an hour, but if you need an hour, you'll get an hour. If you need 2 hours, you'll get 2 hours. If it's in and out and you need, 10, 15 minutes, you'll get that too. So it's really individualized, it's personalized to you, and it offers everything you get from primary care, everything your primary care doctor does, but I would say better and more accessible and
Okay.
more tailored to you.
And so do you end up working kind of as a quarterback for patients from if they need specialists in different ways, and you're making sure that people are going to XYZ specialists and not ABC specialists if that's what they need to, and working the care between the oncologist and rheumatologist, let's say, and making sure that they're not overlapping and things like that? Is that something that's part of your practice?
Yes, Simon, that's great. What patients experience now is a primary care doctor who is pressed for time.
Mm-hmm.
So when, a patient comes in with a complaint or a concern for maybe bellyache or something, they kind of, look around a little bit, but they don't have enough time to dig deeper. So you end up getting a referral to a specialist.
Okay.
So it's not unusual to leave your primary care office with 4 referrals to specialists,
Right.
so they can kind of figure it out. But with direct primary care, what we bring to the table is time. So a primary care doctor really has the knowledge to manage a variety of conditions.
Oh, okay.
So I'm able to sit and really understand because now I have the time, there is time to listen. So you're able to understand the nuances and what's going on and able to manage the patient as the first point of call. Now, when we need additional care or specialist input, then we can work together to send that referral. And not only that, once a patient sees a specialist, they can also come back and review what the recommendations are. So that way we can decide, the patient can really make an informed decision.
So kind of like a built-in second opinion.
Correct. Something like that.
Okay,
Yes. Yes.
that's something that I think many people need because medical knowledge is difficult to attain, as you probably
Correct.
know, seeing as how you
Yes.
probably went to like 20 years of college for this. And when you get told things, you don't always know what you're getting told, and so you just
Yes.
have to take their word for it.
Correct.
Whereas having somebody who has that knowledge in your corner can help you.
Can help you. Correct.
Okay, okay.
Yes.
So, are there any things that you are specializing in right now that are that people who are watching this might be wanting to learn about?
So, in addition to the direct primary care services that I offer, I also started what I call SAGE, which is really focused on perimenopause and menopause care. And as you know, half of the population are women, and any person with an ovary will go through menopause. But we find that only a small portion of women are really getting evidence-based care to manage them during this transition. So, having gone back to really relearn this and understand, creating that space and able to help women navigate perimenopause and menopause journey through evidence-based care, and work with them to really make the right decisions for them, sharing what options are available for them, and guiding them to kind of pick and decide what is going to work best for them.
Gotcha. And that
Yeah.
would include hormone care and
Yes, yeah.
other.
So that would be, hormone care, non-hormonal care, lifestyle choices. And honestly, Simon, when you understand what exactly is going on, because a majority of women do not understand
Mm-hmm.
that it is perimenopause or it is menopause symptoms, and half the battle is really knowing this is what is going on. And it's a physiological process. It's not a disease, it's not a condition.
Right.
But a lot of physicians or practitioners do not have a robust knowledge with regards to the management of this phase. And so a lot of women are, it's a disservice, and a lot of women are not being heard
Right.
with regards to how they can navigate this transition
And
phase.
since that's something that 50% of the population goes through, you'd think we would just kind of that would be part of.
Yeah,
Yeah.
it's coming. It's
Okay.
coming.
Okay.
Yes,
Okay.
yes, it is coming. Yes.
So, is there anything else that you'd like to tell people about that sets you apart from traditional primary care, or not traditional, what we're using primary care
Yeah.
now as?
Yeah. So, I mean, I think we can say traditional because that's what we've been, that's what we are used to. That's what we've
Mm-hmm.
always known. So the difference really is with direct primary care, one of the differences is access. So you do have access to your physician. It's really based on a relationship building model where you have, building a relationship with your physician gets to know you, your physician individualizes your care. You have, um, there's a big focus on preventive care. And, we do manage chronic diseases as well. But once we prevent, we hear that added prevention is better than cure. So we work on preventing, and then we manage, chronic conditions as well to prevent complications.
Got it.
So I think that's really the biggest thing. And I said, the access is really big as well.
Okay.
Yeah.
Well, good. I think that basically explains what you do to me anyway. And if anybody who is watching this has any questions, how would they best get in touch with you?
So the best way is to call the office.
Okay. What's the
Our
number?
phone number
Okay.
475-308-1909,
Okay.
or go to the website northshoredpc.com, and it has all the information. If you're convinced and you're ready to join the membership, you just click, and everything is very simplified. It's all digital, it's all online. If you need to reach me by email, there is a contact information there, and you can email info@northshoredpc.com.
Okay, sounds great. And we are excited to have you as part of the chamber. Hopefully,
Excited.
it's been beneficial to you as well.
Yes.
And if you are in need of a new primary care doctor who wants to spend some actual time with you and think about your particular conditions and make sure that they are going in the right direction, or if you are having questions about your perimenopause or menopause, please reach out to Dr. Abby.
Afolalu.
I,
Abby, yes,
Dr.
I
Abby.
know.
Everybody knows me. I'm horrible with names, so I apologize in advance. So we hope to see you all watch the next one. And in the meantime, reach out to Dr. Afolalu. So thank you.
Thank you so much for having me. Bye.
Bye.
Thank you. See you soon.